name is Karen Kreider. I'm a women's health nurse practitioner with SLUCare GYN Oncology. Today we're going to talk briefly about IV chemotherapy. Hearing that you may need chemo can be very overwhelming, which quite frankly is a normal reaction. Sometimes just knowing a little bit more about what to expect can make it a bit less overwhelming. I know it feels like a lot, but you will get through it and we will be here to help. Chemotherapy is a toxic medication that directly causes cancer cells to die. Cancer cells are fast-growing cells, so they metabolize or use the chemotherapy drug very quickly, which leads to their death. There are different chemotherapy drugs that are used for different types of cancer. Your doctor or I will talk to you about which one is recommended for you. As chemo affects fast-growing cells, the most common side effects are seen with other normal fast-growing cells in the body, such as skin, hair, taste buds, bone marrow, and the lining of the GI system. This can result in fatigue, decreased blood cell counts, nausea, taste changes, hair loss, and skin and nail changes. Certain chemotherapies may carry other side effects. Your oncology nurse will go over them with you at your chemo teaching session. Because of the toxic nature of chemo, it is given through an implanted port, often called a portacath. This is placed below the skin of the chest, usually an inch or two below the collarbone, and is done as an outpatient procedure. Most patients are very glad that they have a port, as it saves them from getting stuck with needles over and over trying to find a vein for chemo infusions and blood draws. You will receive your chemotherapy at an outpatient infusion center. You will also have weekly labs drawn while receiving chemo to monitor your blood counts. Your oncology nurse will talk with you about location options. You will see either the doctor or me in the office prior to each dose of your chemotherapy. Your nurse will provide you with a chemo calendar with all of your appointments. The thing that patients are usually the most concerned about when they hear that they need chemotherapy is how they're going to feel. The vast majority of our patients actually feel pretty good while they're on chemo. We have a combination of medications that you will receive in addition to your chemotherapy that help prevent the majority of the severe side effects of chemo. Our average patient on chemotherapy may experience mild nausea, some fatigue, and decreased blood counts for a few days following chemo. Most of our patients will tell you that by about a week after chemo, they're really feeling pretty good. If you have any questions or needs, don't hesitate to reach out to us. Remember that you are not doing this alone. We will be here to help you and guide you through this process.